Caesarean sections in small ruminants. So the indications include sire selection leading to a large fetus, which will cause dystocia, or an immature first-time mother with a singleton in the anterior presentation, or an incomplete cervical dilation or vaginal prolapse. For the procedure, first, for sedation, give metomidine. Then prepare the area and clip and disinfect. And then for C-sections, it's on the left side, so do a left flank anesthesia. Do a distal paravertebral nerve block, or a sacrococcygeal with xylazine, and then wait 30 minutes. And then give lumbosacral lidocaine at 2%. This is an excellent analgesia. It is best for a traumatized reproductive tract or fetal monsters. However, they can get hindlimb paresis for 3 hours after the injection, which means the lamb can't suck colostrum, so they need nasogastric feeding. For doing the incision on the flank, it's best between the last ribs and the wing of the ilium. And it should be around 10 to 15 centimeters below the process transversus of the lumbar. First go through the skin, then the external oblique, then the internal oblique, then the transverse oblique, and then the peritoneum. With the peritoneum, grasp and lift the skin to avoid puncture. And then make a small incision at first and then extend it. Make sure to exteriorize the gravid uterus. Be careful, it is a thin wall. Then open the uterus with scissors from the tip of the horn towards the cervix, and then remove any blood clot and flush it. Then close the uterus with one absorbable suture, inverting seromuscular. Use Cushing, Utrecht, or Lambert. Do a double row and then seal. When closing the peritoneum and the transverse oblique, do one monofilament absorbable suture with a continuous simple pattern. When closing the internal and the external oblique and the subcutaneous, use a monofilament absorbable suture and do a simple continuous pattern as well. And then when closing the skin, do one non-absorbable suture with a continuous or interlocking or interrupted pattern. After the operation, give antibiotics for 3 days, NSAIDs, and check if there's any toxemia.